Yes. Oh. Continue. Okay, this is the case of Elin Hesman. Hesman, is it, Elin, you are from Denmark, I think. Hesman, does it mean horseman? Is Elin there?
Jacinta, can you click on the continue
yes.
on the recorded meeting?
Let's
so
see.
we can see the presentation.
Oh, yes. Well, I see my, let's see. I'm stop share. No, I should not stop share. Okay.
No, I see the presentation
Please,
very
you
well.
see the presentation,
Yeah.
Stine?
Yes.
Yes, okay. Who's and do you hear me?
Yes.
Okay. So
Everybody is seeing it.
I found it out. We all have to click on the continue of the recording
yes.
of the session.
Yeah, I also clicked on the continue recording. Yes.
Okay.
Okay. My question was to Elin Hestman. What does your family name? Does it mean horseman? Elin is not there.
Hello.
Well,
Elin says she's from Norway.
Yeah,
Elin.
Yes.
well, I don't speak. Yes, sorry.
Can you see me? Can you hear me?
Yeah.
I can hear you. Yeah.
It means horseman. Yeah.
Oh, that's great. What a nice name
And I'm from
for
Norway.
for being an equine vet.
Yeah.
Yes, I tried to prepare your case
Yeah.
with the information you gave me.
Yeah.
And well, I would like to ask you to to tell us more about this case. So you can see the photographs, and I did a summary of your emails. So, but please let us know your findings and what you did.
Yes. It was my colleague's horse, a 1-year-old trotter, who had been outside with the other 1-year-olds. And the person who was looking after them wasn't looking up close daily, I think. So the first picture is a week ago on the left side. And that's actually, I've just cleaned it. They found it the day before.
Yeah.
And there was a small flap in the bottom of the wound there. Yeah, exactly. And you can see it's a bit longer, and as you see, I sutured it on, even though I think on the middle, yes, exactly. It was cold and it was hard, so I told them that this was probably gonna not stay. And I've also used the Danish, as long as it stays on, it does something good. But yeah, I think it helped keeping the lower part of the flap up, kind of.
Shall I move on to the next?
Yeah, you can do that.
So 2 days later.
And I did, yeah, of course, I did quite a lot of debridement there, and
you can see
and sutured as good as I could. Yeah.
And what kind of bandage?
Yeah, I used the Manuka ND, those you can clip as much as you need, and the cruise foam, and just cotton padding, and kept it on for 2 days and gave it flunixin. It had no fever, and there was some diffuse swelling, but not bad. So I tried that without antibiotic. Yeah.
I have a question for all of you, because the horse was found in the pasture. Do you have any, what do you think, Elin? How old was the wound at the moment that it was found? So on the 23rd? What do you think?
Thought it might be a week or so, but I'm not sure. I don't know.
Well, it's not a fresh wound indeed, because you see already, anyone estimation, what would you think, how old would this be? This wound here, because this is after debridement, it looks much better. But how old would the wound be?
It seems like there's granulation tissue there, if I'm not mistaken. So
yeah,
I mean,
quite a lot.
a week.
Yeah.
Yeah. Well, we all know that the formation of granulation tissue in horses is very fast. So it could be a week, it could be less. but at least it's more than 1 day. So if the person taking care of the young horses say, well, saw the horse yesterday and nothing was, I could see nothing, and now we found the horse with this wound, then you know that's not true. It must be, I guess it must be longer. What do you think, Dean?
I agree. I would say 5 to 7 days.
Yeah.
One of my professors used to say there's a big difference between a wound that is suddenly occurs and a wound that is suddenly found.
Yeah. Yeah.
Really
Yes,
true.
Okay, I will move on to the next slide. Let's see. Oh yeah, so that was my question. Then 2 days later, Elin, your turn. So you changed the bandage and you found here the left 2 pictures.
Yeah.
And okay.
And yeah, and as you can see, the proximal part of the flap has loosened, and yeah, I cut it off there. But I was actually positive to the flap, the distal part. Yeah, and I did debridement again because I thought it was too much. Yeah, like you can see the middle with yeah. So I tried to cut down even more without getting kicked.
Yeah.
Yeah, and it was really stinky when I took the bandage off. It smelled really bad. But I just did the same thing, and yeah, took a little bit more, and of course washed it, and had a compression bandage for I think 20 minutes, 15 minutes, and then I put the same kind of manuka and some more cotton.
Yeah.
Yeah.
You had a few questions, Elin. So your questions were, should I have done more aggressive debridement? Well, if does anyone like to comment on that? So we have a traumatic wound, and was the debridement of Elin enough, or should she have done more debridement? Anyone wants to react?
I thought she did a nice job with her debridement on the first one. I think that it just, there's the problem for me on this case is the fact that there's crevices that are easy to hide bacteria. And so one thing maybe, rather than just the surface debridement, using a curette or something to get into the crevices to debride the biofilm there as well.
Yeah. Yeah. In the middle there.
Yeah. I think you almost remove the clefts, because here you don't see them so much anymore. So I think you could remove enough tissue, didn't you? Because here.
Yeah, I think on the second time I took more. I only used the scalpel. I could perhaps have had something else to use, but I did more to get rid of those clefts. On the second time. So yeah.
Yeah, well done. Well, and the clefts form in this stage of the healing process. So it's almost inevitable that you get clefts in these stages.
Yeah.
And the other thing is the extensor tendon movement. So the extensor tendon moves independently of everything. And so that also creates clefts. The other thing you could consider is a splint to minimize the fetlock movement.
Yeah, okay.
Yeah. Another question you had is, does it make sense to suture such a skin flap? So who likes to comment on this?
At this point or initially?
Well, no, what she did in the former 2 days ago. So she found the horse, it was an older wound, she did debridement, and she tried to suture up this skin flap. Is that, does it make sense, or would it, or does it make a difference, or can you also leave the flap, leave it hanging, or, well, what do the people think in this audience?
To be honest, I don't think it was worth the effort. I would have I think left it or removed it.
Yeah. Well, may I say something about these kind of flaps? what I usually do if there is, this is a viable part and it seems tiny, but it's also retracting at this moment already. And if you're able to save this part, so, well, if you leave it hanging, if you do not stabilize it, it usually flaps down and then it will contract and it will disappear. But if you manage to save this part of the flap, it can finally, when the wound starts and it gets attached to the underlying granulation tissue, at a time that the wound starts to perform wound contraction, then it may be able to close this side of the wound. So what I often see is the tiny flaps in the later on contribute to wound healing considerably. So I'm in favor of keeping up flaps in more or less the right position, and sutures may help that, but in such cases, please use monofilament sutures because they do not increase the infection rate. And of course, you must be care that no exudate and bacteria are hiding under the flap. But if this flap is kept in this position, it may contribute to healing of this part of the wound. That's my experience, but perhaps other people have other experience. So I don't know.
But you can just normally, in my experience, just keep it up with the bandage and not with sutures. I wouldn't take the trouble of adding sutures to that thing there.
But you would keep it.
Yeah.
I mean, always keep it.
Yeah. I mean, that looks very healthy, actually.
Yeah, and it's several square centimeters. So that's for a horse, that's a lot.
Yeah.
Dean, what would you do?
I would keep it for sure. I too would probably have sutured, but at the very least, I would have held it up with the bandage to try to keep it in its normal position. What happens to me if I don't suture them is that they tend to curl.
Yeah.
And then I lose bits of it. And so I do that. Now the problem is the minute you suture, you lose the ability to get underneath it very well to clean. So it's a give and take, but our horses, those curl over and then that becomes, I lose a lot. So I like to put a couple sutures in as well.
Yeah, me too. Yeah. Thank you. Any other comments on this question of Elin? Okay, Elin, your next question. Are there better options for this wound than honey? Who likes to comment on that? Nobody?
Well, I probably would use hypertonic saline. I'm a big fan of hypertonic saline in these wounds. I think it's a little more aggressive in its debridement than honey. I think this wound has got enough biofilm and other things that it's not a problem. Once you have it cleaned, then the hypertonic gets very irritating. So you have to be careful with it. You have to pay attention, but I probably would have done a polyhexanide dressing soaked in hypertonic saline.
Yeah.
Both of them.
Yes.
Okay.
Could you use flaminol alginate liquid one for this one because of the pockets and because of the tissues already in line of the wound to prevent hypergranulation?
Well, in flaminol gel, you mean, Neeltje?
Yeah.
Well, if you look at the wounds, if actually you almost have a complete granulation bed already, only not under the skin flap. So in fact, you don't have to, it's not necessary anymore to stimulate this wound to produce more granulation tissue. And that means that in fact, you don't use it, you should not use alginates anymore, and actually in horses also not honey anymore. So I would stop in this stage with honey ointments and what we need now. And Elin mentioned that the wound was smelling. So there will most likely there will be a colonization or perhaps a local wound infection. And so I would choose for an antimicrobial foam. So the foam to absorb the exudate and the antimicrobial parts to reduce the number of bacteria on the surface. But in horses, it's very important to stop the stimulation as soon as you can, because otherwise you get exuberant granulation tissue, so hypergranulation.
And what would you use on the pockets, sort of like on the right side where you don't have this nice granulation tissue?
Here, you mean here?
Yeah.
Yes.
Yeah,
you
under
can-
the flap.
Yes, you like to have a connection as soon as you can. So you need, and most importantly, need healthy granulation tissue without bacteria. So that's debriding, and also debriding because it's curling already a little bit. So under the flap, you sometimes have to debride and place it back if necessary. But reduction of the number of bacteria, and in that way reducing the inflammatory response becomes important, because then you will see the wound contraction. So that would be my personal advice, Elin. So to stop honey and to use a foam, and in this stage to use an antimicrobial foam. So to work against the bacteria.
Yeah, with that, I don't know what we have actually, but what would be with silver, or is that?
Yes, it can, or polyhexanide.
Yeah.
That's also an option. You have foamed with polyhexanide. Yeah, so one of these. Yeah.
Yes.
Anyone else? Comments? No? Your last question, skin graft?
Not yet.
No, I don't think it would take.
Oh, you will be surprised how quick you can do a skin graft. Not in this stage, but after a week you can. And it's a large wound. So it's always good to suggest this to owners. It depends on, well, in the yearling, they often say, oh, it will heal if the horse has time before it can heal. But nevertheless, it's a big wound, so it will be a big scar. So I think it's good to take that into account.
Yeah, and this is where I'm always talking to the clients about skin grafting. Not yet, it's not ready yet, but I think it's something we should be talking about, and I try to prepare them. Because when it's ready for skin graft, I want to do the skin graft. I don't want to wait for them to think about it for a while. I'm always having that conversation now.
Yeah, that's right. I always do it early in the beginning, because I see that we, in general, we lose many weeks of time by waiting until contraction stops, and then it doesn't, the healing is very slow, and then we think about skin grafting. But if you know from the beginning, this is a large wound, we are going to aim for skin graft later on, you can, in your wound, in your treatment, you can aim already for reduction of bacteria, etc. And a wound like this one on the 25th can be ready in 7 or 10 days to have to take a skin graft. So that can be much quicker than we sometimes think. So I can show your next slide, Elin. So the pictures of today. And I must agree that you have managed to get a rather good wound surface in a short time. So you did it very well, I think.
It didn't smell as bad either.
No, it's getting healthy. You can see that. And you can see also that your skin flap is retracting more and more. So finally, if you leave it like this, it will, it retracts too much, and it will not contribute to healing. And that's because there's granulation tissue under the skin flap, and therefore you see the flap contracting. So if you like to make use of this one, and if you you have to take away the granulation tissue on the back side, and then it may be able to enlarge it again. Oh, sorry, I have to go back now. Let's see, yeah. And then you can enlarge it again up to a size like approximately this size. But it's the contraction of the granulation tissue under this healthy skin flap that makes that the area is reduced so much. Okay.
So I need to cut it loose again, kind of, and
yeah, and take away the tissue here if you like to use it for a future. On the other hand, if you see the size of the rest of the wound,
Yeah.
you have to talk with the owner if they like to do a skin graft. Any more
Thanks.
comments on this case or questions? Elin, do you have questions?
No, or you would have used the hypertonics salt, or what it was called, from the beginning, kind of after the first debridement there, or?
I probably would have, but maybe only for 24 hours, just enough to get rid of whatever superficial bacteria and then move on. And I mean, you've done a marvelous job with this, going from a pretty unhealthy looking wound to a very nice granulating wound in a few days. And so I would not argue at all with what you've done, but I probably would have, at that point where you debrided it the second time, I would have done 24 hours of pretty significant antimicrobials just to take care of that. And it looks good.
Thanks.
I have actually one question that's a little bit adjacent to this kind of wounds. In dogs, we see a lot of bite wounds where you have like this one part of the wound is a nice granulation tissue, which is viable for doing some skin flaps. And on the other side of the wound, you have this part where you still feel like you need to wait if it's getting necrotic or what happens with that side of the wound. Do you decide to do a skin flap on the healthy granulation tissue and then talk to the owners about a second skin flap on a later moment in the wound healing? Or do you start to wait if the other side of the wound is still getting necrotic, or what's going to happen on the other side?
I would personally prefer to wait for a while until the other side of the wound is healthy, because otherwise you have the chance that bacteria from the unhealthy part go to your healthy part where the skin flap is placed. And additionally, you don't want to do two surgeries on the same animal. Well, in veterinary medicine, we do not do that so often. In human medicine, it's normal that you do everything you can do, you do it at once, especially in burns. So people with burns get 5-6 surgeries. But in animals, we prefer to wait for a while. And I would certainly wait until, well, the main part of the wound is healthy. Sometimes if you have a small part that's not so healthy, you can do some debridement and you can include it in the reconstruction or in the skin grafting procedure. But that cannot be, then it should only be a very tiny part.
Yes, thank you.
More questions about this one?
I think we should move on because
then we go ahead, because we also try to do your case, Stine. Well, now we have a small animal case. It's a case with the most small animal practitioners know, cats with axillary wounds. Usually they have been caught in in a trap or whatever, and they get wounds in the axilla, and these wounds can heal very badly. This cat was presented to me in November last year, and we started to do bandaging. I've seen very good results of that. So just a primary wound care, so usually clipping, washing and disinfecting the surroundings of the wound, and then a bandage with the proper dressing. And you try to immobilize with the 8-formed bandages, you try to immobilize the axilla. Well, this cat was healing, well, slowly. It's usually slowly, but every time when it was moving more, the wound broke down and it was again 4 by 4 centimeter. We decided with the first line veterinarian, we decided for reconstructive surgery. And in this area, actually, you have 2 ways to apply reconstructive surgery. You can do a thoracodorsal axial pattern flap or an axillary fold flap. That's a transposition flap. I discussed this case with Mirja from the Veterinary Wounding Association, and she was not so very fond of the thoracodorsal axial pattern flap. And actually the axillary fold flap is also less invasive than the thoracodorsal. And therefore I did an axillary fold flap. Well, this is after the surgery. So what you do is you use the fold in the axilla, so the excess of skin, and you take it away from here, so the proximal side of the elbow. So here you take away the flap, you transpose it to the axilla, and it's sutured here. The wound is bridged to the flap, and then you can suture this flap into the axilla. And you can close this wound easily where the flap comes from. Actually, it's not a very difficult surgery, and we were able to suture this without tension. So everything looked very nice. The wound was covered with antimicrobial foam, so to absorb any exudation that could happen. And again, the axilla and the forelimb was sort of immobilized by 8-formed bandage over the top of the thorax, including the other leg. Well, 1 week, 8 days later, we see this. So you saw the former picture, it was nicely sutured. And here we see that there seems to be either dehiscence or disappearance of skin. And I would like to discuss about this case, because a few days later, 4 days, 5 days later, the flap was completely disappeared. And my discussion with all of you is what happened here. You can see that the site where the flap came from healed by primary intention, but it's just the flap being sutured here did not take and is apparently not viable, or something else happened. So I've a few ideas what happened, but I like to have everybody's comments on what's going on here and why did the flap disappear.
Can you go back to the photo or the slide where you had just done the?
Yes, I can. Here.
Okay, thanks.
Yeah. So there was no tension on. It was easy to suture everything. The flap was including the skin muscle. Come help me. The panniculus.
So one thing that I use when I do rotational flaps is I never have a flap more than 2 times as long as the width of the base.
Yeah.
It's a very long flap.
Yeah.
Yep.
In small animals, they take longer flaps. So yeah, it was. I think it's always, because it's difficult. It might have been wider. I agree. Yeah, because this is the width, and the length was perhaps more than twice the width of the flap.
And it also looks like there's only the skin flap disappeared on the part that's where the cat is moving.
Yeah.
Because on the leg part, the skin flap is neatly attached. It starts at the moving point again, where the elbow is.
Yes, this part is still viable, and this part disappeared.
Yeah.
Yeah. Anyone ideas what happened?
Yeah, I was going to ask if the flap was too thin, but you said you had the panniculus width, so it's not too thin.
No. So was it motion? It can be, Neeltje. That might be one of the reasons. I'm a little bit afraid, because the flap disappeared completely, that it possibly has been an infection. So with one or the other bacteria. And we know culturing from wounds, it always gives an outcome, and you not always know if that's the cause. But we did not culture from this wound, because in fact the owner was very reluctant to do anything, and I did it for free. I did this surgery for free already, so we did not culture after this. But because the flap disappeared completely, I'm afraid that it might have been an infection.
But I also see a lot of cases where the owners, where we do some free work, where the owners are not so motivated, that I wonder if they really understand how important it is to keep the cat inside a bench and not moving, and how compliant the owners are.
That's right. I fully agree, because I have owners, also small animal owners, that do everything you say. And some owners are indeed, the compliance is not very good. So of course we advise to keep the cat in the bench, but you never know what they did. No.
And did you do a blood examination beforehand? Like, isn't there something that's prohibiting, yeah, like diabetes or something else in the cat itself?
And not the prime, the first line vet did not do that very extensive blood investigation, but the cat seemed healthy. So it seemed a normal, healthy cat. What do you think, Dean, about that this might have been caused by infection? Do you have that experience that flaps completely disappear?
Well, no, most of my flaps are much larger than that, so that's hard for them to completely go away, but we'll do some.
I mean, the flaps should have been larger.
Yeah, we just had a horse that we did, that the dentistry did a sinusotomy on, sinus flap, and everything died, and we had to go in and do some reconstructive surgery, and again, had minimal tension, everything seemed great. And lost about 2/3 of the flap. And I too think our problem was infection, but in this case, I think it was a fungal infection that we fought with more so than a bacterial infection in this horse. And I saw some fungus on the flap, but I removed all of it and thought that I had it under control, and I think maybe not as good as I wanted.
Yeah.
But yeah, I do think bacteria will cause the problem. And I'm wondering whether this has had an underlying bacterial infection all along and you just never cleared it. And that's why it kept opening up over the 5 months.
Yeah, that's normally not, because it was dressed with the antimicrobial dressing. So normally you can get rid of bacterial colonization. So wounds are going to heal then. But yeah, perhaps.
Something a little deeper. We've had some of these very slow growing bacteria that are deeper in the wounds that don't look like they're causing big problem, but we've come back later and found them. And then when we aggressively get rid of everything deep, then we get success in healing. And so I wonder in this case whether there wasn't a deep bacterial infection on just a really slow growing bacteria that caused it to not heal to begin with, and then led to the destruction of the flap.
Yeah. And is it also dependable on the cause why the wound is there? Like if it is a trauma case that the underlying tissue looks healthy but isn't actually really healthy? Could thermal imaging help in this case?
I thought about that.
Yeah.
Yeah, I think this would be a really interesting one. Again, as we start to play with the thermal imaging more, just what can we learn from that and see?
So next time, Neeltje, we take the cat and come to your clinic if you organize a thermal aid.
Definitely.
Yeah. Okay. Well, it's a shame that Mirja is not here, but I can share this with her later on. And if something is interesting to discuss later on, we can include that in any webinar. So shall we move on to the next case? No comments? Then we do that. Okay. Okay. This is a case, equine case, but still very interesting what happened. This was an expensive dressage horse, was bought with a big scar on the calcaneus, the lateral side of the calcaneus. And you can imagine what happens. The horse was in a new, with the new owner, and within a few months, the scar broke down and there was a wound, and that wound was not healing. It's a defect of approximately 10 centimeter height, so from including scar tissue and wound, and the width was approximately 14 centimeters. Well, of course, this wound is not healing, and you can see a very desiccated wound surface, and there will be definitely a colonization that's also influencing or stopping or delaying healing. So I think if you would bandage this wound in the right way, healing would start, and you can manage to heal this wound. However, then you still have the epithelial scar on the lateral side of the calcaneus. So the horse still has the same problem. And therefore, I discussed this with the owner and with the own vet. And because there is some excess of skin here, we decided to give it a chance and to do a reconstructive surgery. So in order to take out all the scar tissue, so excise the whole wound surface, and then in an attempt to cover the wound with full thickness skin coming from here and suturing here. So in order to have full thickness skin here, but also to prevent a scar here at the lateral side, so then the final scar will be here. Well, this is the surgery. I've made some drawings of it. So the skin was taken from the medial side of the calcaneus. All the scar tissue, including the wound surface, was excised. So in fact, it was by going under the granulation tissue, in fact, you have a clean wound thereafter. And I created a long flap of approximately 20 centimeters and was able to accept this final part, was able to suture this over the calcaneal area. Well, the horse was placed in a full limb cast for 2.5 weeks. I think, I can't remember because it's an old case. Usually I used 3 weeks immobilization, but I think because it was a full limb cast that we might have had some tiny problems or whatever. But we took it off after 2.5 weeks. And when the cast was removed, yeah, you can imagine that nobody's very happy when seeing this. You can see that the skin flap, well, there disappeared some tissue. The sutures are here, sutures disappeared over here. And what's the most obvious actually is that the skin, the full thickness skin thinning. So it seems to be a regression of the skin. So also the thickness was reduced considerably. So the question is, what happens with the flap and what's the reason? So was the flap too long? Is it a matter of perfusion? And of course we need we would need the thermography of Dean or of Neeltje at this time that would have been very interesting, or would have been interesting after the surgery before we placed the cast too. Is it possibly, was the tension too high? Because that also influences the perfusion of the flap. Could it be pressure by the cast or are there other factors? And I'm not sure, Dean, if I discussed this case with you in the past. It's a case from 2006 already. I discussed it with Derek Notterman, I'm sure, but I might have discussed it with you too. But it's a nice one to discuss now. What happens?
I think the cast pressure, because it's the only thing that explains the thinning. The only thing that explains the thinning of that skin to me is cast pressure, because even if it dehisces because of tension, you still have the same thickness of skin, but I think pressure.
Yeah. And tension, you don't think that tension can give the regression of the skin, so the thinning of the skin?
I don't think it does it as much as that, unless you see the tearing. If it's tension and you see tearing of the sutures along those, then maybe I buy that. But otherwise, my experience is if they dehiss, you still maintain the thickness. It's the pressure from the cast that would be the most likely to make it thin. Yeah,
and the length of the flap?
Seems fine. I mean, the length versus width seemed like it was a very good flap.
Yeah, it was a thick, long flap.
Yeah.
Yeah. Anyone more comments? No? Okay, so the pressure of a cast, well, that's interesting because I thought it has been the combination of a long flap with too much tension. And because the cast seemed to be okay, but perhaps indeed, because you also see the other pressure source by cast is that the skin is becoming red and hairs disappear, and it's also getting very vulnerable then. I will show you the next pictures. So what happened? So it seems horrible over here, but what you see after 1 week, it looks already better. And then after 2 months, you see that the thin skin over here regenerated. And there's only a part that was definitely lost. And actually, the rest of the flap regenerated, and the wound, of course, contracted. But you can see by the shape of the flap is that we lost finally a part of the flap. So, well, you can think, oh, it was a horrible case and what we did was not very well, but actually, if you see that from this, we managed to go to this point in 2 months' time, and the wound was not healing, no progress the 2 months before, I think we finally, the surgery was not too bad to do. And finally, what we saw, this long-term follow-up, the horse was used, was in full working after a while, and you can see that the final scar is quite a tiny scar, and you can see also all the scar tissue here, and well, here you have a small scar, but a large epithelial scar that was placed here on the top of the calcaneus disappeared, and this was the final scar. So in the end, it's we were all happy, but after taking the cast off, sometimes you feel horrible at that stage. Yeah.
Mhm.
Any comments?
A lot better scar
Yes,
to work with over such a place
yeah.
of the hock of a dressage horse. So that is a big improvement.
Yeah, it is. Yes, I agree. Yeah. Any more comments on this case? No? Okay, Christina, then we can go ahead with your case.
Yeah, it's I'll just do it rather briefly. It is, I don't have a lot of information about the case anyway, so, but maybe you can give me some advice. So this is not about a skin flap, but more the common problem of having poor quality scar, poor quality skin after second intention healing in the horse. So this was, oops, sorry. This was a filly that was admitted to our clinic and with an acute wound that was debrided and sutured by another vet and kept in a bandage, treated with penicillin and a little bit of non-steroidals and nothing else because the wound seemed uncomplicated at the time. And then at bandage change, 10 days later, the wound had completely dehisced. So looking like this. And there was exudate that was slightly purple or bluish, and with that peculiar smell, and wound swabs also showed that we had Pseudomonas aeruginosa infection in the wound. So it was treated with topical antimicrobials, and it was discharged and went on to heal with to the owner's satisfaction. So that was looking something like this eventually. And now she contacts me approximately a year later to say I have the problem of a wound opening on occasions. This has happened 2-3 times in the recent month, and with some mild hemorrhage from the wound. There's no lameness, there's no swelling, there is training of the horse, it's a young horse. which is being trained from the ground, not ridden, and it's nothing that is too exhausting. So the condition is relatively self-limiting, but it's because it's, I mean, then it goes on to heal a little bit more, dry out a little bit more, but this is annoying to the owner because it then opens again, and she wants to compete with the horse in approximately 1 month's time. Obviously, you cannot do that with a horse with an open wound that has a mild hemorrhage. So, and it's something that we see fairly frequently, I think, that we, after wounds that were infected and were treated with open wound management, that we see these poor quality scars. So my question is, could this be avoided? Is this something in the initial treatment? And are there any relevant treatment options at this stage? Can we in fact improve the quality of this scar? So I'm looking actually for input from this very knowledgeable audience here to see if somebody has. The owners, they always tend to they want to use aloe vera cream or something like that, and I'm not aware of any evidence that has any particular beneficial effects.
No, but it helped their neighbor's horse heal.
Yes, exactly. Or I mean, you know, it's natural ingredients, so it must be good, right? Derived from a plant. So it's something like that. I mean, it's not something I discourage, but it's not something I really like them to do, because I feel these when the skin is like this or like this, it's, in my experience, never good to have it too moist, because then it tends to open a little bit more.
May you comment a little bit on the aloe vera briefly?
Mm-hmm.
Aloe vera has the component asimanan, and asimanan has been tested by Steve Swaim on dogs, and it appears to stimulate macrophages and to increase, to promote healing. So in fact, the base of aloe vera is not too bad. However, aloe vera, well, it's usually sold in different formulations, and then there's everything included, which usually not so good for wounds.
No.
So if you would just put the asimanan on the wounds, that would be would be good, like we use alginates, or like so that could be a good point. However, it's usually mixed up with other stuff, and that makes the problem. But that's not an answer to your question, what to do with this filly.
Does any of you have any experience with collagen on scar improvement?
No improvement, no use in horses. No.
It doesn't work, or do you don't have? Okay.
No, it has been tested.
Yeah, I don't think you can add exogenous collagen and then have the wound heal.
No. Actually, what you must, in any wound, small animal or equine wounds, the first thing you have to do is to aim for a healthy wound surface. And you can add everything, but if the wound is not healthy, you have to do the proper preparation of the surroundings of the wound, and you have to do debridement, etc. So a very simple care that everybody can do, and then a good wound dressing, choose for the right wound dressing, and adding all these stuff and regenerative medicine, so collagen or stem cells or whatever. If you don't have a healthy wound, it will not do the good job. Yeah, but that's beyond this case. Stine, you like an answer on your case?
Yeah, if somebody has any, I mean, suggestions, I think we on occasion happen upon these, I mean, chronic poor quality scars after second intention healing, and I'm not aware of any miraculous treatments.
Well, may I comment?
Yeah.
Well, actually, this is the whole thing of my work, because if horses or other animals too have a wound that has healed but is not functional, then we have to find a solution. And in a case like this filly, what I would like to do is to, and I'm also very interested in your opinion, Dean, I would debride everything, take away the old scar tissue and do reconstructive surgery, a cast for 3 weeks, and then it will definitely will be a functional scar. And the problem is with all the scars on the top of joints, they always give a problem, and therefore in these scars on the dorsal side of the fetlock, on the dorsal side of the tarsus, etc. If it cannot be closed by reconstructive surgery, I always do a graft, because also with grafting, you have a better quality of scar. So quality of scar in the end is very, very important. And the caseload I get of non-functional scars after second intention healing is quite high. So I quite often take out all the scar tissue and remove all the fibrous tissue, and then I do reconstructive surgery.
No, that's what I suggested to the owner, and she was not super inclined to have surgery. So I thought, okay, let me bring it here to see if you clever people had any miraculous treatments. But I thought that was also my suggestion to her, to have a surgery.
Yeah, I think that's the only way, because it's just below the fetlock joint, and it will open up the rest of its life. It will become worse and worse, because there's more irritation, there will be more thickening, it will be more stiff, more fibrous, so the problem will not decrease but increase. So if she likes to use this horse for championship, then she has to do something now.
No, but I agree. No, I agree.
I know, Dean.
I agree. I think it's the only good choice.
Yeah.
There is another one. So we have some of our clients are very willing to do everything and others are not. And the other choices I've had some success is doing a good debridement and then just putting them in a cast. So it's similar. I can do the debridement standing. I can get them in a cast standing, and I can reduce some of the expense. It's not nearly as good. No question. The very best thing is to debride, and I agree with Jacinta. If you can't close it, put a graft in immediately, and then put them in the cast to do that. But I just, everything else we do is just they're just wasting time. They're literally wasting time and wasting money while they're waiting to do this. And I feel for you, Steen, because I think it's such a horrible case to be in. And it's probably just because there was some Pseudomonas deep in this wound when you first saw it, and we just weren't able to clear it. And
I'm sure.
And that caused the dehiscent. But I think short of this, if you don't do everything, you're really just wasting their money.
No, but I totally agree. It's just and I'm happy somebody, I think you mentioned it, Jacinta, they think, oh, it's a young horse, it has time to heal. I see that a lot. And you try to explain that probably it will be the rest of the life of this young animal. But I'm just glad that at least I have backup from absolute experts.
Well, you can tell them that. But it's sometimes we listen too much to owners, and well,
it's their horse, so you have to listen.
You have to listen, but actually, if they think for, surgery is too expensive, and then I do this, and they sell this, and they buy this for the wound, and in the end, if they would add everything, all the costs they have made for ointments and other stuff, and all other people, they ask for radiation and all other modalities that are not scientifically proved, then in the end their costs are much higher than if we do one surgery and do a cast for 3 weeks and then it's ready to go.
No, you're
and that's
absolutely
not a
right.
different surgery. You're including casting. It's a surgery of 1.5 hours. So It's not that difficult.
No, but that was my case, and I don't know if anybody else brought cases we should discuss. Otherwise, I think we have had almost 2 hours of wound fun.
Yeah.
And I think we should really thank Dean for an excellent
Yes.
presentation. It was so interesting.
Thank you.
And thank you very much for contributing. That's what the pandemic has taught us, right? That
Yeah.
we can do something online, and that makes it a little bit easier to meet across the Atlantic and so on.
Yeah. Yeah.
Very true. Yes.
So I think I will just stop the recording.